Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Edward Morrison. He is a vascular surgeon here at East Cooper Medical Center. Thank you so much for having us today.
Thank you.
All right, so I'm excited about this because we're getting to know you as well as the practice. So let's just talk about how you got started, where you're from, all of that good stuff.
Well, thank you for your time. I'm not new. I've been doing this for a little while, 31 years. I'm born and raised in Charleston, in Old Charleston, and went to school here and then off to boarding school and college in Virginia and medical school at the Medical University, general surgery training there and vascular surgical training in Houston. That's a mouthful. Yeah. But took about 13 years after high school to get to that position, and came back and joined a big practice that has evolved, and I was mostly at other hospitals 31 years. I've moved my practice exclusively to Mount Pleasant, to East Cooper Hospital now.
I love it. All right, so what is it? What is a vascular surgeon?
That's a great question. My late mother would say, well, you know what he does, veins and such, okay? And that's a perception that is fine, but cardiovascular disease and atherosclerosis still remains the #1 killer of the adult population. And we take care of people with blood vessels disease, be in the arteries or veins, in all walks of life. Vascular surgeons do all blood vessels in the body, that is surveillance, repair, whatever has to be done, management, except intracranial, and those are the heart arteries. So our territory is fairly vast and diverse. The population right now, especially in Mount Pleasant, has changed so dramatically, of course, in the last 20 years, 110% increase, and demographically, and the need for vascular surgical services, if you will, and support on this side of the bridge has been significant. So it's been a delight for my colleagues and I who help congeal and bring this together to come here.
So what is one of the main things you see, or most often, most common?
So
problems?
any place you have blood vessel blockage, just start with arteries. Arteries take blood everywhere in the body, and veins bring them back. Any place arteries go, to your brain, carotid artery, for instance, plaque, blockage in this artery leads to stroke. We intervene on these. Your abdominal aorta, the big blood vessel in your body that has blood supply to your viscera, your intestine, your kidneys, etc. One of the most common things is really tied into the whole epidemiologic catastrophe of type 2 diabetes, and that is lower extremity blood vessel disease.
So is that like varicose vein?
Well, I'll get to veins. This is arterial blockage.
Oh, my bad, when you started.
But we'll get to veins in a second. So obviously, loss of a limb, amputation, is a catastrophe. And the amount of problems that we have with people with losing limbs and threatened limbs from type 2 diabetes is epidemic. Huge part of our practice, tremendous part of our practice. As I mentioned, veins take all blood back to the heart. The biggest problem we have is varicose veins and what's called venous reflux, where blood's pooling in the lower leg, and it's estimated, just as an example, ladies your age, 50% of them probably have venous reflux and varicose veins. They may not see them, may not know them, know they're there, but they can have pain, swelling, and tenderness and have significant symptomatology.
Is a lot of times do you find that the people notice them because like cosmetically they think they're...
So you'll have everything from cosmesis to stage 4 disease where you've got skin breakdown and ulcerations. Most patients are in between the two. What happened about 20 years ago was really a quantum leap. Until that time, to take care of a varicose vein patient required an operation which was disfiguring, didn't work, and no one was happy, including the surgeon. And the minimally invasive technology that came around allows us to do it literally on the bed here with the assistance of an ultrasound technologist.
And y'all have like crazy good technology here, right?
The technology is tremendous. For veins, we're doing everything from closing them down. What you're doing is shutting down a conduit of blood that's going the wrong way, with anything from mechanical, thermal ways to basically almost glue-like materials. So that it depends on what a patient's needs are, the contour of the vein, but it is readily available here and a big part of a vascular surgical practice.
So what makes you kind of different? Because I feel you have a fantastic personality, and I feel like, you know, you got great bedside manner, I feel. I haven't been a patient, but I watched you with some of them, and I think that you have very good energy. So
Well,
when people come here, what do you hope that they walk away feeling?
one of the things, and I probably do irritate my staff, the staff, is that I tell them, you don't have to be correct all the time. You have to care, okay?
Oh, that's
and a
good.
patient, and I'm not talking about a varicose vein patient from living in a suburb, but a patient with a major vascular disorder knows they have a life or limb-threatening problem, and they need somebody to integrate with them, relate with their family, because it's usually a catastrophic problem, and be it a carotid or an aneurysm or a leg that's dying, and yet I think what we offer is that right there. We still deeply care about patients, and in a system that is, it's very easy not to care about patients anymore. It's so easy not to.
And you hear about like bedside manner and the amount of time that doctors are able to spend with their patients. So you can definitely tell you're passionate about that.
Yeah, it's a pleasure. It's an honor to do that. It really is.
Alrighty, well, it was so nice chatting with you today. So thanks again for having us. And for more information, you can head online to eastcoopermedctr.com.